Hi, I'm Dr. Jared Gardner, and I just wanted to share with you this cute little hypertrophic actinic keratosis. I thought it was a particularly photogenic example, and it's got keratinocytes that are atypical and jumbled down at the base. They're large compared to the smaller normal basal keratinocytes over at the side here, the normal skin next to it. And it's got a really cool kind of warty looking surface. It's undulating and papillomatous, and every once in a while actinic keratoses get kind of a warty look on the surface of them. And in this case, it's even got little spires of parakeratosis with orthokeratin, meaning keratin without the retained keratinocyte nuclei in between. So that's the way like actually a wart would grow, but I think with the jumbled atypia here, actinic keratosis is a better name than verruca or warts. So sometimes you can see lesions that have overlap between the two that look like a wart, but have also some AK, actinic keratosis inside them. So this is caused by chronic sun damage, and it's kind of a form of dysplasia or precancerous keratinocyte change, and a subset of actinic keratoses will progress into squamous cell carcinoma. And actually, this one probably is just incidental at the edge of a bigger biopsy, because over here we actually have a thick area that looks like actinic keratosis on the top, but down at the bottom is starting to invade into the underlying dermis. So this is the main reason they did the biopsy here, was to remove this, which is an invasive squamous cell carcinoma arising out of a background of actinic keratosis. And there's also some prurigo or lichen simplex chronicus change from scratching and picking. But then at the very edge was this cute little actinic keratosis, which is just a second one. Some people have lots and lots of sun damage and lots of actinic keratoses and skin cancers on their skin. And you can tell the patient has lots of sun damage because look at the dermis. The dermis is normally filled with pink collagen bundles, which would be about like this color. But in this case, the entire dermis here is replaced with this blue-gray kind of tangled fibers. These are elastic fibers. So this is solar elastosis, really severe solar elastosis. This is not the kind of change that you would get from going to the beach occasionally. This is day in and day out, hours and hours of sun damage over many, many years, where the dermis is filled with this tangled mats of elastic fibers that push the normal collagen down, and they replace the normally pink collagenous looking dermis with gray-blue solar elastosis. So this is a sign of heavy chronic sun damage over many years. Usually we see in elderly patients in sun-exposed sites to have that much sun damage. This is definitely very severe solar elastosis, and this is the kind of environment where we often see actinic keratoses, squamous cell carcinomas, and other skin cancers. So I just thought this was a kind of a cute-looking little actinic keratosis, which was just an incidental finding here, but I wanted to share it with you. Thanks for watching. Hope you have a great day.